To carry on from where Tony left, it's also important to realize that apart from the fact that 80% of people with diabetes live in the developing world, in the low and middle income countries, you must also realize that almost 50% of people with diabetes remain undiagnosed. And that is a big issue. So when you have hyperglycemia and you are undiagnosed, you are likely to get increase in the tuberculosis infection and manifestation into active TB disease. The other problem that affects this comorbidity is the fact that when one disease gets diagnosed, people often ascribe the symptoms to that disease because the symptoms can be rather similar. For example, a person with diabetes, with type 2 diabetes, would often complain of loss of weight, would complain of feeling tired, and malaise and kind of not feeling well. And the same might be the symptoms of tuberculosis. So if you're caught onto tuberculosis, you say, oh, I got this. This was the reason why this person was not feeling well. The same is the situation with diabetes. When you caught somebody with diabetes, you tend to ascribe all the symptoms to diabetes, and you may not look for TB. Given the fact that diabetes increases the risk of tuberculosis threefold, it is very important that we do something about a bidirectional screening, where people with tuberculosis are screened for diabetes, particularly in countries with, I would say this should be done everywhere in the world, given the high rates of diabetes globally, and in countries where there is a very high burden of tuberculosis, we suggest that all people with diabetes are subjected to at least a symptom screen and then followed up in terms of finding actively if they have tuberculosis. The other important point is that active TB disease, because there's an infection, actually worsens diabetes control. And people, it is difficult to control diabetes, and a difficult diabetes to control worsens the TB infection, and it creates a negative cycle. Also, the important aspect is that while diabetes, while obesity and overweight protects people against tuberculosis, it actually increases your risk for getting diabetes. And also in terms of treatment advice, it becomes a little complicated because for patients with tuberculosis, you want to, because they are in a catabolic phase, you want to give them healthy nutrition and good, and increase their body weight. In case of diabetes, you want to control that. And so it creates a bit of complication in managing the two conditions. It has been really fortunate for the World Diabetes Foundation to have worked with the International Union Against Tuberculosis and Lung Disease, where we started this collaboration, I guess, about 6 years back. And over time, the World Diabetes Foundation has been funding many projects in the developing countries. We focus on diabetes, but increasingly we are funding a lot of initiatives in the developing countries on the double burden of diabetes and tuberculosis, primarily because this is something that impacts the life of the poor and the most vulnerable sections of society, particularly those living in urban, poor urban areas in the slums, where both diabetes and tuberculosis is becoming a big problem. I'd leave it at that and perhaps take questions later on.